So let's talk about shock, right? Shock is very important in EMS. Much of what we do in EMS is either the treatment of shock or trying to prevent shock. And these can be very, very sick patients. So shock is a decrease in perfusion throughout the body. The body's no longer able to provide enough oxygen to meet the metabolic demands of the body, and you start to develop dysfunction, right? You can develop multi-organ failure, you can have very low blood pressures, you can have high heart rates depending on what's going on, and these people look sick. And it's very important to be able to what we call differentiate the type of shock, right? So we need to be able to sort of determine the cause to be able to treat it. And in order to do that, we need to understand the different categories of shock. So when we're talking shock, we should be thinking about things like distributive shock, and that would be something like sepsis. We could be thinking about obstructive shock, such as things like a pulmonary embolism, cardiogenic shock, where there's an issue with the heart, hypovolemic shock, which can then be like low fluid states or possibly a hemorrhage. And then we could start thinking about things like maybe even a neurogenic shock, which kind of falls into distributive, but I like to separate it just in my own head. So if you can think about these different causes, then you can start building your treatment plans around that.
What helps you understand better? Reading from your textbook or watching super visual videos like these? If the answer is videos, then you need to check out EMT Mastery. It is 100% online school and exam prep aid with hundreds of visual videos to every topic that you need to know in EMT school. On top of the videos, you get illustrated notes, worksheets, interactive games, and even live tutoring with our instructors 3 times a week if you're struggling with any topic. Want to check it out? Hit the link above or below this video for a free 3-day trial to see how quickly you can start crushing EMT school.